Hi everybody, my name is Maegan Bell and this is my 5-minute YouTube video on ocular foreign bodies. An ocular foreign body occurs when particles, normally dirt or sand, become entrapped in the conjunctival sac or the corneal epithelium, and they can normally be seen without any kind of magnification. The symptoms include normally unilateral photophobia, lacrimation, pain, a foreign body sensation, feeling, and redness. Risk factors for a foreign body in the eye include your job. If you work around dust, metal, glass, sand, wood fibers, or splinters, any kind of airborne particle that can blow into your eye. Another risk factor is playing sports and also being involved in any kind of explosion or accident where foreign body projectiles are involved. Key questions to ask in your workup are: number one, is this an emergent condition which is going to warrant immediate referral to ophthalmology? This is important because providers need to recognize these immediately and refer to prevent further injury to the eye, blindness, and infection. They will include intraocular foreign bodies, corneal foreign bodies that are not easily removable, and any foreign body which resulted from an explosion or a blunt, sharp trauma. Second key question you want to ask is, how did this happen? It is important to ascertain an accurate history. You want to know when, where, how, and this just helps you also recognize again, is the injury more serious than you originally thought and needs to be referred. And lastly, you want to ask the patient, are they having any eye pain or vision loss? Again, these could indicate more serious injury and the need to refer to ophthalmology. In your physical exam, you want to first measure the visual acuity of both eyes, both before and after you remove the foreign body. With a simple conjunctival foreign body, you should have 0 to very mild vision loss. And you also, again, want to do it after you remove the foreign body to make sure that no damage occurred from the foreign body in the removal. Number two, you want to examine and look for the foreign body. You can at that point establish the size and location, whether it's a single or there are multiple foreign bodies involved. It does require full examination of the eye, including the conjunctiva and sclera. It's very important to avert the eyelids at this point and never be content with just finding one foreign body. Continue looking, finishing your exam of the entire eye. And again, at this point, you can figure out the severity of the injury, make sure that the foreign body hasn't penetrated the eye and caused more extensive damage than you may have originally thought. And lastly, in your physical exam, you want to determine if a corneal abrasion is also present. Because a corneal abrasion will require a little bit further workup and treatment, you may need to involve a slit lamp and fluorescein dye at that point. The treatment for foreign bodies in the eye is, of course, number one, to remove the foreign body. You can do this with saline and sterile water irrigation, and also the use of a damp, sterile cotton tip swab or applicator. And removing the foreign body just prevents further injury to the eye, prevents infection, and the patient may not experience immediate relief, but it should improve over the next 24 hours. Secondly, you can prescribe eye drops or an eye shield or patch. This is usually unnecessary for foreign bodies, but if they are experiencing a lot of irritation, you can give them irrigation drops for lubrication. You can also prescribe antibiotic drops if you suspect that there's a mild corneal abrasion as well. You can do NSAIDs and pain relief, again, if they're having a lot of discomfort, and the patch to rest the eye. And these all just help decrease the discomfort to the patient and the risk for infection from the foreign body. Lastly, in your treatment, you do need to reevaluate the patient. You need to remeasure visual acuity, making sure it is either the same or improving. And again, see the patient back in 24 hours to make sure that the condition is improving and not worsening. When you're teaching these patients, you want to tell them to always wear proper eye protection, especially if they work in an at-risk area or play sports. They should be wearing the proper glasses, shields, and goggles, and that just helps prevent injury to the eye and foreign bodies in the future. You also want to teach them avoidance behaviors. Number one is don't rub the eyes. This is true to prevent foreign bodies from occurring because you could rub dirt or eyelashes into your eye. But also, if you have a foreign body already present, you could worsen the injury to the eye. Another avoidance behavior to discuss is contacts. If you have a contact user, they want to discontinue all usage of their contacts and wear glasses until the eye is healed, and that just prevents further injury and risk of infection when foreign bodies are present. Lastly, in teaching, you want to educate your patient on the treatment recommendations, especially medications, because some of your patients in family practice may not have been exposed to eye medications. They may never have used eye drops or ointments. So just instruct them on the proper use and installation. So that's it. I hope you enjoyed this short video on ocular foreign bodies. Thank you for watching, and War Eagle.